This video aims to give you more information about radiotherapy for gynaecological cancer at the Northern Radiotherapy Network. Whether you are coming for radiotherapy in Middlesbrough, Carlisle or Newcastle, the treatment you receive will be standardised across our network. It is just the location and the setting that will be different.
When we're talking about gynaecological cancers, there's a wide range of cancers and everybody's treatment is very different, tailored to that specific individual. So we use radiotherapy quite a lot in gynaecological cancers, and it's used in a wide variety of settings. So as a curative treatment, as an adjuvant treatment, so that's after surgery to reduce the risk of recurrence, and also as a palliative treatment to improve symptoms and quality of life.
What is radiotherapy? Radiotherapy is the treatment of cancer using high-energy X-rays. The aim of radiotherapy is to try to cure the cancer, reduce the risk of recurrence following surgery, or to control it for many years. There are two ways that radiotherapy for gynaecological cancer is utilised. For most types of gynaecological cancer, external beam therapy is used, which is radiotherapy from outside the body, using a radiotherapy machine. For some types of gynaecological cancer, you may be given brachytherapy, which is a type of internal radiotherapy. Please view our other video about brachytherapy for more information about this type of treatment. There are different techniques used to treat gynaecological cancer more effectively, and your consultant will detail and explain the options to you. The different techniques treat the cancer whilst protecting healthy tissue and reducing side effects.
So we try as best as we can, to get the dose to the target area and limit the dose to the organs at risk. And we do that, for example, using what we call intensity modulated radiotherapy, which is a very targeted focused type of radiotherapy to reduce the dose to the organs at risk. And we work within certain constraints. So we have a certain constraint, for example, we don't want the dose to your bladder to go above a certain constraint, to your bowel. So we work within those constraints. So that's why it takes a couple of weeks to plan all of that, and there's a bit of technical work that goes on.
Planning a course of radiotherapy is very important because it ensures each treatment is given accurately. Your treatment is planned by a team of radiographers and dosimetrists under the supervision of your consultant. The planning scan involves the use of a CT scanner to identify where we need to treat. A CT scanner is a donut-shaped X-ray machine which is used to take pictures that the team use to plan your treatment accurately and to target the area that needs to be treated. This procedure takes about 10 minutes and is completely painless. The therapeutic radiographers will have checked the referral from your doctor, and they will also ask you to confirm your consent. They will explain what clothing needs to be removed and help you achieve a comfortable position, which you will repeat each time you attend for treatment. Keeping still for the scan is very important, so if you are not comfortable, please tell the radiographer and they will try and make some adjustments. During the scan, you will need to lie in the same position you will be in for your radiotherapy. To ensure you are always in the correct position for every treatment session, we will make some permanent marks, the size of a pinpoint on your skin. These tattoos show where we need to direct your treatment.
So a tattoo in our language is just a very small black permanent dot on your skin surface. It is permanent, but they shouldn't be visible. They're usually hidden for our patients behind their underwear. If it's something that you're particularly worried about, quite a few of my colleagues have got one on the back of their hand, and I'm sure they'd be willing to show one to you if necessary. It would be very difficult for us, if not impossible, to deliver your radiotherapy accurately to the pelvis without those tattoo dots.
You will have image-guided radiation therapy. This is a method of radiotherapy that incorporates imaging techniques during each treatment session. Your clinician will talk you through any other treatment planning that is relevant to you. A team of radiographers will treat you. You will be asked to lie on the treatment couch, and the radiographers will use the skin marks to position you in the right place under the treatment machine. You will need to be in the department for bowel and bladder preparation before each treatment. The treatment itself usually takes around 20 minutes. Most of this time is preparing you, like getting undressed and positioning you. You will feel no pain or discomfort. We ask you to breathe normally and to keep as still and relaxed as possible. You can play music during the treatment. This can be your choice and played into the room or through headphones. Most machines make a noise. This lets you know the treatment is taking place. You will be alone during your treatment, but the radiographers will be able to watch you and listen via an intercom and closed-circuit camera system.
The planet scan, and when you have the treatment, it moves around you like an X-ray beam, so you won't feel anything, you won't see anything, you can't feel the treatment at all. The treatment itself lasts about 20 minutes, but the preparation does take longer. As I say, you may need to use an enema, and we possibly ask you to empty your bladder and then drink cups of water, and that is to ensure that your bladder is the same size at each treatment.
Side effects of radiotherapy treatment for gynecological cancer usually start a week or two after your treatment. They may continue to get worse after treatment finishes, and then will gradually improve over the next few weeks. Your radiotherapy team will explain what to expect and how to manage any side effects. Please view our video on side effects for gynecological cancer for more detailed information.
We will support you through this journey. We are a friendly team. No question is a silly question. Please just pick up the phone. There are also your local teams for support as well. And we do, it's not just physical concerns, it is holistic concerns as well. So that's your psychological well-being, practical concerns, emotional concerns. Your local nurse specialist in your region should offer you a holistic needs assessment at the end of treatment. Having had radiotherapy, would recommend that this is done at about 12 weeks after treatment. This is to allow your normal side effects to die down, so we get a true picture of how can we support you. But obviously, in the meantime, just pick up the phone.
Following your treatment, your health professional will talk about what happens next. You'll have ongoing follow-up with your healthcare team.
We absolutely understand that it's a very difficult, emotional time for women undergoing treatment for the gynecological cancers. And often what I tend to see is actually when you're having the treatment, you're just focusing on getting through a day at a time. And it can often hit you at the time when you finish the treatment, and suddenly, you have a lot of time on your hands to think about your diagnosis, to think about what's happened. And what we would say is please pick up the phone, please reach out to us, and we can organise counselling, we can organise clinical psychology support to help you through that.
We are aware that some patients may require extra support and help whilst visiting the department. If this is the case, please let us know either in advance or on the day of your visit, and we will assist with your needs in any way we can. If you're running late for your appointment, just let the department know, and please don't worry. We try our best to keep to appointment times, but delays do happen sometimes. If we are running late, we will let you know. Please visit the Northern Radiotherapy Network website if you have any questions or queries.